So what we're gonna do right now is we're gonna concentrate on the glabella area right here. This is like the 11s. You know, some areas, some people it's more pronounced than others. One great thing about it is the line is not creased there. Is by injecting you prevent that from happening. The other thing which we're gonna do is we're gonna do some in the forehead, and the forehead is it's interesting in that what you want to do, you want to soften those lines, but you don't want to make that initially completely flat. The one problem, if you try to make that too flat, is it pushes the eyebrows down, which you don't want to have, and then it looks angry or sad. So what we're trying to do, we'll put a little bit just to soften it, so when you raise the eyebrows, it doesn't crease that that vigorously. So we're going to start in the glabella area right here. Okay, go ahead and frown for me for a second. Good, relax it. And right in front, that's just so we can see where the muscles are. Okay, we'll inject this side first, right side. Okay, good. And a little bit more left. The one good thing about BOTOX is that the needle used for is a 30 gauge. You know, it's a really small needle. It's about the size of a hair, so discomfort is pretty minimal with it. Okay, now we're going to do the forehead. Now raise your eyebrows for me. Good, relax. Foreheads are always a little different. Everybody's forehead is a little more, because some foreheads are more broader than others. Some people have more lines on the forehead, so the pattern of injection does vary a little bit depending upon the shape of somebody's forehead or where their lines are. Okay, very good. Raise your eyebrows. Good, relax it. And what happens is, usually what I like for patients to do is, for the next hour after we do BOTOX, is having to use those muscles. About every 5 to 10 minutes we try to use those muscles, and what it does, that just forces the body to take the BOTOX up better. So it just works better. If you don't do it, it will still work, but that just enhances the effects of the treatment. And what I'm going to do now is I'm going to put a little cytoactive on. What cytoactive is? A hyaluronic acid gel. And what that does, it just reduces the risk of bruising. This is not a heavy bruising procedure, but when you do that, it just reduces the risk of it. Some of the old theory was that you couldn't lay down after you had BOTOX, and that probably doesn't really matter, but the important thing is to use those muscles, because when you use those muscles, it really does increase the effect of the, enhance the effect of the BOTOX. Okay, so that's pretty much a standard treatment which we use for the glabella and also the forehead area. Sometimes once again the forehead, depending upon the shape of somebody's forehead, you vary maybe a little bit more, a little bit less, and that's individual. Men tend to take more than women do, but that's pretty standardized treatment for that area. Can you squint for me, everyone? Okay, yeah. So a lot of times when you squint, you see these lines, we call it bunny lines on the sides of the nose that tend to like scrunch together. And that's a thing that is very natural. A lot of people tend to get that, but that's an area that you can tend to help a lot of times with BOTOX. And what we do is it takes about 5 units on each side and just helps to soften that. So I'm going to show you how we do that. I'm going to turn your head a little towards me. Good. Squint real hard for me. Okay, good. Relax it. Good. Now I'm going to turn this way. And it seems to squint real hard for me. Once you can see how those lines get accentuated, relax it. And then same thing, we put about 5 units in here. Okay, good. And relax it. And the thing with BOTOX is this: it takes It takes about 4 to 7 days for that to take full effect. So same situation. What I try to get most people, depending on what area we treat with Botox, it'll try to get use the muscle. So the muscle, like the squinting, try to get somebody to do that, looking at in this area. And what that will do is the more we use the muscle, the more it takes it up. You get a little bit of puffiness afterwards, as you know, a little bit, but as you know, as soon as it's massaged, that resolves pretty quickly. As always, I put a little cytoactive. I like to use it's a little hyaluronic acid gel, and what that does, that helps to reduce the risk of bruising. Anytime you inject them with a needle, there's a risk of bruising. Most times, even if somebody gets it, it's going to resolve pretty quickly in 2 to 3 days, but this just reduces the risk of that happening. All right, very good. Okay, well, now we're going to do around we call it lateral canthus, what most refer to as the crow's feet. And this is a common area, and that really comes from squint real hard for me. Yeah, you see, is that from that movement? That's what makes you can relax that. That's what makes that line develop. And what we do, we prevent that from scrunching completely. One thing about that is a lot of times is, can you smile for me? Okay, yeah. Sometimes when people smile big, some of that comes from this muscle pushing up here. You cannot eradicate that. A lot of people say, well, you know, well, every time I smile, I get a little bit. You can't eradicate the whole thing, but there's a muscle around the eye. What you do is to soften that so it doesn't scrunch as hard, but you can't completely block all movement around the eye. And we're gonna put a little bit around here. Usually in a situation like this, a little about 20 units around here. And what I do is kind of a little fan pattern around the eye is what I use. The needle for Botox is very fine. It's a 30 gauge needle, so this is not a painful procedure, but then it just softens. You get a little bit of puffiness right after the procedure, but that goes away. Even if somebody some people will swell a little more, but even so, I'd say within the next usually half hour, that usually goes away. And then what I always like to use is a little hyaluronic acid gel. And what that does, it just reduces the risk of bruising. Sometimes you have a little redness too from the injection, but same thing, that all those things go away. I say next 30 to 45 minutes that will resolve. Okay. Okay, now we'll go to the other side. Okay. Now we're going to do the crow's feet, or medical lateral canthus on the left side. Have you frown for me? Good. Or squint real hard? Yeah, so then once we see that, and smile for me. Yeah, and see how it really accentuates lines. And the one thing about it is, when you smile, you push up something from the cheek. You can't eradicate that, but the lines, if you squint real hard, that's what makes it better. You can relax it. And same thing, I put a nice little fan pattern around the eyes. One thing, a key thing of Botox is the needle is very small, so discomfort is usually very minimal. This is the area of the skin, because the skin is so thin around the eyes, can be more tender, but usually it's very well tolerated. But afterwards, I'm going to put a little massage a little bit. I don't like it's not that somebody's do this at home. The thing I should try to have you do the next hour after the procedure's done is just to squint. About every 5 to 10 minutes you squint, because as you squint, that forces your body to take the Botox up better. Put a little hyaluronic acid on. Okay, what we're going to do now is I'm going to use a little Belotero. It's a little filler for, what I call it, the smile lines out here. And these lines come just from smiling over time. The skin creases there. In my mind, it's one of the more difficult areas to treat. Sometimes you can treat them with some of the lasers now you can be used on them. It's hard to treat with most fillers because it makes it too bulky. Or the other issue with that, if you try Botox in there, but it can really affect the movement of the mouth when you try to smile. So the thing I find works best there is Belotero. And the key thing about it is that what we're trying to soften is, we're not going to make, key thing with cosmetic procedures to me is you're not making it perfect. You're just trying to make it look better. We look better for where we're at. So with that, I'm going to start at the lower pole here. Okay, a little stick. And what happens is I'm going to put a fine bead of material. underneath the line. As we see, it just gets it to lift up there. Keep going. We've had the numbing medicine on about 15 minutes. As a topical numbing medicine, it helps this. Okay, just a little bit more. We just this line lifting as we go. Hyaluronic acids are nice materials because what they do is they absorb water. So a lot of times with time it swells, so you get better results with that. Yeah, just doing great here with this. Again, I like to put, if you can imagine, it's almost like a lattice work. So as we put a little bit, the more material we put in, under here, the better it gets us to soften up. She's just doing great here. Yeah, these lines are always tough to treat unless we stop smiling, which is not what we want to do. Okay, good. And when it's done, it just softens this line right here. It's up with water, it's going to make that smoother. And in just a minute, we're going to come back and we're going to massage that area. But first, I'm going to go around. We're going to treat the other side. Okay, now we're going to treat the smile lines. These lines right here. Smile for me for a second. Yeah, relax it. See, when we smile, these really get accentuated. And these are hard to treat because we still keep smiling. So what we try to do is we try to soften it. So we put a little filler right underneath here to soften that. The filler I'm using today is Belotero. I like because it's fairly light for fine lines like this. I think it works better. And we're going to start down here at the bottom. And what I'm doing is just laying a thin bed of material underneath the line. So we just get that to lift up a little bit. And the one good thing about it is that we've had numbing medicine for about 15-20 minutes. That helps to make it tolerable. It can be a little bit sore. The needle's very fine, but the material going in sometimes can be a little tender. But she's doing really well. And what we've done, yeah, we just soften that line to go hit this superior portion right here. You're really doing great. Now what I'm going to do, and you can see already how much that has softened that effect rate, how much softer that line is. I'm going to go put a little sideways, creating almost a lattice pattern to raise this up. And one thing with the hyaluronic acids, they tend to absorb a little more water. Belotero doesn't absorb as much water as the other ones do, but as that does, it makes this get better and better. And the nice thing about this is it's a very thin material, so if you want to kind of soften the line and you want to go out to a party that night and you don't want to look like you had something done earlier that day, this is a good material for that. I'm going to put a little bit up here. You see, it doesn't take very long to install the filler. And then what's going to happen, I come back, and you feel a little bit of firmness. You feel a little bit of firmness, not much. And what I do, I massage that. You may feel a little firmness for like about 2 or 3 days, but then that will go away. And usually I have to put a little bit of ice. That's on the day of the procedure, and that's just to prevent any swelling. And usually, but usually by even that evening, you're fine. Okay, very good. Okay, now what we're going to do is we're going to do some of the lines around the mouth, the little lip lines that we all get, and that all comes from a lot of people call them smokers lines, but a lot of people get them, don't necessarily get them from smokers. It's all from muscle movement, just how we move our mouths that make that happen. And a couple of different options with those things. You know, peeling's an option. You can use BOTOX to soften the movement. If somebody's lips are real thin, you know, sometimes you can put filler in the lips to make it. In this situation, they're fairly limited, in my mind, fairly mild. So what I'm going to do is put a little filler in the lines themselves. The one I'm choosing more is Belotero. The reason I like Belotero is in the situation, it doesn't swell a lot. And once again, but you can use a lot of things. Juvederm, Restylane. It really depends what feels comfortable in the physician's hands. I think in the situation, Belotero is going to go real well. And we've had numbing medicine on for about 15-20 minutes. This area is a little bit more tender, and now we're going to put a little filler into those lines. That's it. Okay, here we go. We'll start here. And what we do is I thread it up, and we try to put like a bead of material in there. So if you can see the line just start to puff as the material goes in there. Do the same thing right here. Start the corner here, just it. And just thread them there, and just a little bead of material. We just want to get these lines to soften. And see, it just lifts that line as we go. You can see how it just softens those real nicely. We're going to come massage this, we'll have that to smooth out real nicely. And a little bit in the center here. Sometimes a little bit more tender right here, just sorry for discomfort. I'm saying that just a little thin bead of material. And just helps to soften that. It's doing really good. Really softens these lines real well. We're going to come back and do the other side first, and we're going to start the lateral one here first. And what we'll do is insert the needle, and then we inject some material as it comes out. It's just a little bead of material. You see it lift up as it come out of there. Then we just soften that down, smooth right out, and we're going to go to the next area here. Same thing, it's just a little injection. Lips are a little bit more tender. I always say that's why it makes kissing so fun, is that the lips are real tender, but they really are tender when you move material. And we just put a bead, and you see it just softens those lines right there. There's a little area, might be a little tender here. This line extends a little bit further, so I'm going to put a little bit of material up here. Okay. There's a tad more right here. Good. Now we're going to come over to massage these areas, and it's a little open mouth thing, a little puff right afterwards. We massage it; it will smooth out real nicely, and these areas do really well. Really quick procedure. The thing I like about this, especially this material around the lips, is it doesn't swell as much. Leave a little ice pack afterwards, but it really doesn't swell that much. Whereas you can do that, and you got to function, you know. If it's Friday evening, we're in good shape for that. And afterwards, what I do is I massage these areas where the filler goes. And what that does, that just helps to make it smoother. So, it just helps to let, and that's when the filler first goes in, it's going to feel a little, you'll feel a little firmness there for a couple days, but that goes away. The patients who've never had this before, who have never had it massaged like this, and they really love the effect of the massage. It gets a lot smoother really fast. And then we'll massage the lip here. Some people that bothers them, they don't like the feeling on by their nose.
Oh.
This is great. But you can really feel the difference. You feel how that just gets smoother and smoother as you massage it. Okay, good. Okay. Yes, and as we massage the areas that have had the filler, it just makes that smoother. There's a couple little pinprick marks. This is from the injection, but we're going to clean it off in a second. That will go away. And then after I usually put the filler on, I put a little hyaluronic acid, and what that does, that reduces the risk of it bruising after the procedure. It's hard to completely eliminate that, so that's why sometimes somebody has a procedure, have them try to avoid the aspirin, or if they're taking any blood thinner, obviously want to come off that, or even if there's somebody's taking a lot of non-steroidals like Motrin or Naproxen or ibuprofen, I try to have them to hold that if they're doing a filler. Yeah, and I'd like to put the hyaluronic acid gel, and what this does, just reduce the risk of bruising. It doesn't completely eliminate it, but does reduce the risk, so just don't have to worry about getting out that night and have a bruise mark there. If somebody by chance does a little bruise, it's usually very quick, resolve in a couple days. Usually covered with makeup. Very good. Excellent.